Thank you. So, am I on? Yeah. It's always really funny to see your own picture on the screen. It still makes me a little bit feeling funny, but it's done. Always happy to speak in the beginning of the day because I usually don't let myself drink coffee before a presentation. You know, your heart starts to race and your mouth gets dry. So after this presentation, I get coffee. So it's a good motivation to get this done. So a little bit about myself, you already heard it, go through it really quickly. Since 2001, I worked on cannabis, started my PhD in Holland, the first one to study medicinal cannabis in the Netherlands. And in my education, I combined biology and pharmacy. So I'm a kind of a biochemist of the cannabis plant. Got a lot of information in my PhD in Holland. Then I got involved in the Dutch cannabis program, together with Canada, the first program in the world that was set up by a national government. And I started working with the only licensed producer in Holland called Can, and became their head of research and development. But then we split ways. I started to focus more on education, set up a master class each year. It takes 5 days. It's a 5-day course for professionals from all around the world. And more recently, I'm doing consulting. So that's enough about me because we're here more for you. And I had to kind of estimate what kind of a audience are you guys. And I think you all know, first, why about chemistry? Why am I talking about chemistry this morning as a very basic topic? There's a lot of topics you can work on with cannabis. And I chose cannabis because I realized that in a group of very diverse people in this room, you all know that medicinal cannabis exists, and you maybe use it, you may prescribe it, you may study it, but do you really know what's going on in this plant? What are the molecules that are doing the work? Where do they come from? How do they interact with each other? And the same with CBD oil. It's available everywhere right now, but if you look at the label, can you truly understand what's happening there? Is it only about CBD? What about quality? What about composition of other molecules? So how do you actually pick the right product in the real world? That is not so easy. So I think it's important to know how things work, otherwise you can't actually be an expert. Can you really say you're amazing with cars when you don't know how an engine works from the inside? Or can you be an amazing cook if you don't know anything about ingredients? And can you claim that you are an expert in CBD consultation or in producing it or selling it if you don't really know what's happening actually in this wonderful plant? So I like to start that exploration here. What does normal modern medicine look like? I know we all have feelings about modern medicine opposed to herbal drugs, but modern medicine is a process, and it's made up of 2 main ingredients, and that is chemistry and statistics. The chemistry is done in the lab. It's all about how does it work. I have a molecule and it's supposed to cure or treat something. How does it work? How stable is it? What does it look like? Can I improve it? Can I formulate it in a way that works better than before? And then the statistics come from clinical trials. And that's all about when does it work? For what people? And what's the chance that it's going to cure you? 80%? 50%? So how do I compare different treatments to make a choice for an individual patient? So it's chemistry and statistics. And I think you're going to hear more about the statistics parts from other speakers later today. And I'm going to focus on the chemistry. And it's good to realize that a normal modern medicine has 1 active ingredient usually, right? So if there is any effect on the patient, positive and negative effects, then it's because of this 1 molecule. And that is very easy to study. It's a one-on-one relationship. If there's a medicine with 2 active compounds, then it's already more difficult. What is every individual active molecule doing? Is this one helping and this one is not helping? Are they reinforcing each other? Are they doing 2 completely different things to help the patient feel better? That's more complicated. And now we're talking about cannabis. And we have this. We have a whole soup of cannabinoids, terpenes, flavonoids, all these molecules that you probably heard about. And they're supposed to do something, but how exactly? Which one is causing an effect? Which one is causing a side effect? And is it always the best choice to just throw them all into an extract and then hope for the best, right? I'm sure a lot of people here think, well, that's all true, but it doesn't matter to me because I already know what I want. I got it figured out. I did some research, and I think that I know what's best for me. And sometimes patients, they go to their physician and say, you don't know anything about the endocannabinoid system, so I'll tell you what to do. Just give me this product, and I'm going to be fine. And why is that? Because we have the internet. And you can find amazing schedules with beautiful colors that say, if I cannot sleep, I need CBN. And it looks like very well organized, very easy to use, but I call this copy and paste Wikipedia science. And this is not going to convince most physicians, regulators, or scientists. This is something that has been collected from all over the scientific literature, animal studies, preclinical studies, a little bit of clinical trials, maybe some biochemical binding studies on receptors, but this is not medical science. We're not there yet. It doesn't mean this is not necessarily true, but it's too simple. This is not the whole story of cannabis. And why is that? Because we're trying to find a link between some kind of a cannabis that I want to use and an effect that I like. Less spasm, better sleep, less pain. But like in any condition, the condition can be different because chronic pain comes in 100 different types. Cancer, there's a lot of different types of cancer. So I can't say, hey, CBD works for pain. It depends on what pain, caused by what, in what stage are you. So people are different. Man versus woman, small versus large, lots of body fat versus very skinny. Metabolism can be different. And that's normal for any medicine. Right? The person and the condition are different. But now, with cannabis, we have other things on top of that. We have all these different varieties. Sometimes we don't even know exactly what's in them. We just call them by name. We have different dosing systems, from smoking to vaporizing to CBD oil to extracts. And then we have different administration forms and dosings. So how much am I taking every day? Am I taking the same amount? So how can I ever see a pattern with this? And if you do the multiplications, some math, and you agree, okay, there's about 100 varieties, maybe even more, maybe 1,000. There's at least 100 diseases. There's a number of administration forms, different kinds of people, low, medium, high dose. You have 1 million or more combination possibilities. And do you really believe that there's even one single person in the world that can say, oh, no, I've seen it all. If you come to me, tell what's your problem, I'll tell you what you need. It's not possible. You can be lucky and you can be on the right path, but this makes me very skeptical. I don't think this is possible right now. There's too much variability in all these different aspects. So why chemistry? Because it's exact. I don't want to call this strain Blue Dream or Purple Haze. I just want to have a list of the ingredients. I want to know exactly what's happening every single time. Because then I can have much smarter and more reproducible discussions about what's in it, what can I expect, how does it work, so I can start building up real knowledge. And that's normal, because any other product you buy has some kind of a form of an ingredients list or specifications. Even when you buy an iPhone or a laptop, it tells you what it does. If it doesn't do that, you're going to be mad at the company you bought it from. Why doesn't that apply to CBD or cannabis? It's like, oh yeah, but it's cannabis, it's very special, it's a little bit different every time, but it's your medicine. Why would we want to accept that? We want labels, and labels are chemistry. This is all made in a chemistry lab. These are measurements, right? So examples, varieties, we can talk about them in terms of smell and color and sativa, indica, all kinds of shapes, but this is a chemical discussion. What is in it? If you use it for a recreational drug just for fun, great, you can talk about other things, but as a medicine, I want to know what is in there that does the job. Sativa indica, is that a real thing? Are they two different plants, or do they just have different shapes and colors? When it's about my medicine, I don't care about the leaf shape and the flower shape. I want to know what is contained in these buds. That's chemistry. CBD. We already know from the literature that if you buy CBD in a random country around the world, about half the products don't even contain what they claim they do. Some CBD products contain nothing at all. And yet people claim that they sleep better than ever before. So that is a chemical question. So let's start with a look at the plant, all the way from the bottom up, right? And when you look at cannabis, and I'm sure a lot of you have done it, but probably not everyone. Sometimes it's just not legally possible to have a close look at a cannabis plant. You start to see fuzzy structures. It looks kind of hairy almost. And when you get even closer, you see, yeah, it's true. There are little hairs on this plant. And if you get a microscope, you go even closer into the plant, you think, hey, what's that? It's like a tiny little stick with a drop on the end. And that is called a trichome. And that is the little chemical factory of the cannabis plant. Because at the end of one of these stalks, which I always think they look like Martians with a helmet and no arms, there's a few cells. And they do all the work. Just 4 or 8 cells on each stalk, and they excrete stuff. And it collects like a little bubble, a sticky bubble around those cells. And that's where the cannabinoids and the terpenes and some other compounds like waxes and lipids are produced. And because of oxidation and the influence of the environment, the sun, the air, you'll get a kind of a layer of a bioplastic around it. It's a nice little packaging form of nature to keep all these compounds safe inside. And if you break off the droplet here, it's very easy to do, and you put all those little droplets together, then you make hash. So it's all the good stuff, minus this whole plant still attached to it. Actually, the cannabis plant makes much more than just that. Cannabinoids and terpenes, there's at least 100 or more of both, but there's a whole bunch of other molecules, but we're going to focus on the cannabinoids and the terpenes in this discussion. But altogether, we know about more than 500 chemicals in this plant. And people are amazed by that. They're like, wow, that's so amazing. The cannabis plant makes 500 components. Isn't that very special? But that's just because we know it. Because since the 1960s, 70s, 80s, we've been studying these plants for drug abuse. So chemists were very interested to know what's in there and what does it do? Does it make me high? Is it bad for my health? Does it influence my driving skills? So that's why we know. But it's not special because every plant has at least 500 compounds. A banana has probably tens of thousands, and broccoli as well. And we eat much more of those than we consume of cannabis. So don't make the mistake that you think, ooh, 500 molecules, that is like a treasure trove of active molecules. They're just there, you know. And people often say, hey, Arno, what does this cannabinoid do? And then I have to say, well, maybe nothing. And it's hard for them to believe, but it's a cannabinoid. It's like, yeah, but it doesn't have to do anything. Maybe we're lucky that a few of them have amazing properties, maybe more than we know, but why do they all have to do something? Because cannabis is special. If you believe that, that's intelligent design, right? That's not science. So I don't go there. So what we have to do is to have a look at all these different compounds and all these cannabis varieties and kind of sort through them. And that's what scientists and chemists are trying to do right now. And it's a long process. The ones that are not active, try to take them out. The ones that are more toxic than beneficial, let's remove those. The unstable ones that you can't work with because in 2 seconds they fall apart. The ones that are in such small minorities that you can't even isolate them, can't work with them. So we are trying to figure out which ones are active but also useful. Are there other medicines that can do much better than this cannabinoid or terpene? Well, maybe we should use those ones instead. So it's a selection process. And we've done this before. Going back to the pharmacopoeia that was just mentioned in the opening speech, we know about plants that can do these kind of things. And opium is a really good example because it was a narcotic plant, caused a lot of trouble in society. People got hooked on opium and it was a big mess. But we were able to sort out certain molecules that do more good than harm because we have endorphin receptors in our body. And we can play with them, just like with cannabis, and we can turn them into medicines that range from anesthetic when you go to the dentist, all the way to going to the operation room and you need opiates. Without opiates, you could not be operated in the hospital. So they're really important, but it doesn't mean they all work and they're all the right thing to choose. So now let's move on to the major class of compounds that are really unique to the cannabis plant, the cannabinoids. And it's good to realize, because it's sometimes confusing, that there's 3 different types. There's the one made by the plant, sometimes called the phytocannabinoids. We can make them in the lab. They look completely different chemically. Synthetic cannabinoids, they're sometimes used as drugs on the market, as spice, for example, and our own body makes endocannabinoids. And I won't tell you too much about endocannabinoids today. I will go more in detail tomorrow. But we talk about plant cannabinoids right now. And the 2 major ones that we all know is Thc and Cbd. And just to show you how specific chemistry can be, here's an example of the THC molecule. And if I take a scissors and I cut it open right here, then I've made CBD. Just one tiny cut, that's all. Same building blocks. And it makes a world of difference. THC makes you high and has specific medicinal effects like pain, nausea, MS, and it's a controlled substance. But after I take this tiny little scissors and I make a cut, I made a molecule that does totally different things. And it's a free molecule. Maybe it becomes a novel food, but it's not a controlled substance right now. And because of human breeding, THC has ended up in the marijuana cultivars that we use because we wanted to get higher and higher and higher. So we've selected little, nice to grow and easy to harvest plants, usually for the THC, although they can be as big as a Christmas tree, of course. And we've also selected other varieties that were not allowed to have THC because of the law. And I'm a hemp farmer, so I can grow plants, but it cannot have THC, and a little bit of CBD is like a leftover in those plants. So we have the CBD is now associated with hemp, and THC is associated with marijuana, but it doesn't have to be that way. Now things are becoming more legal. We're crossbreeding those things, and very soon, maybe already now, you will have a fiber-like hemp plant with THC, and you can put CBD back in marijuana. That's just human breeding and selection. So you'll see a lot of more varieties in the future. But there's more cannabinoids, because in the plant, it's like a little factory, right? So the plant takes two molecules that are easily available and connects them together and creates what I call the grandmother of all cannabinoids, CBG. Easy to remember, G, grandmother. And from there, you can make other molecules. And that's done by enzymes. And those enzymes can be on or off. And that is what they mean with genetics. If you say, I have a cannabis genetics that makes these different molecules, that's because the enzyme to make it is present. That's how your breeding and selection and genetics turns into a chemical factory, the cannabis plant, that makes what you want to make. Maybe right now this is not so a shock anymore, but until a few years ago nobody really knew this, is that the cannabis plant doesn't actually make THC and CBD. We're always talking about these molecules as if they're produced by the plant, but they're not. Not even a little bit, because the plant makes cannabinoid acids. And I don't know if that's very well known in this room, but it's quite relevant because the way the plant makes its cannabinoids is in a more soluble or easier to transport form called a carboxylic acid. And we talk about THC as the active ingredient, but it's only after heating. Because what do we do with cannabis? We smoke it, we vaporize it, we bake it into cookies, we make cannabis tea, or we make oil. And you don't know that, but in the oil production process, you have a heating step. This is how GW Pharmaceuticals makes Epidiolex and Sativex. So the same is true for all the other cannabinoids. They're made as acids, and only after proper heating, not too much, because then you burn them and they go into smoke, but you can activate them into those molecules that we know much better. But acids are also active sometimes. So we never looked at them as active ingredients because we were always focused on cannabis as a narcotic drug. So we wanted to get high. THC acid doesn't make you high, but THC does. So that's why you always had to heat. But only when the medicinal discussion really started to develop, that's when we realized, like, hey, what happens if I take cannabis and I put it in my blender and I make a smoothie? Does that make you a hippie that only cares about green food and raw foods and things like that? No, you're doing a chemical thing. You're not heating it. So maybe your illness, whatever you're trying to treat, is actually benefiting from these acids. And that's why you can see more and more of these products coming up. I don't think we know enough about their toxicology and their long-term effects, but there's a reason for it. It's a different set of cannabinoids that were originally present in this plant. Then we move on to the terpenes, and we realize these icons, they mean like it's a woody smell, or it's a fruity, or a lemony, or a piney smell. So this is a way to talk about it in words. Like, what is the smell? What is my impression of this cannabis variety? But it's actually because of the terpenes. And if you do a Google search, then you think that maybe terpenes are all to do with cannabis, but that's because cannabis and terpenes are quite popular right now. But actually, terpenes are everywhere in nature. Everything that smells in your garden or your kitchen, I think you can be guaranteed that there's a terpene in it. Lavender and roses and menthol, all those kind of things. Lime. There's more than 50,000 known, so they're really all over the place. And if you want to know what a terpene looks like, you can go into the pine forest and touch some pine tree resin that is almost pure terpenes. So it's very sticky. You can't wash it off with water and soap. It's really annoying, but it smells really good. That's almost pure terpenes. And they smell. And the cannabis industry has says, hey, that's great, because then nature has done the advertisement for us. Because pinene common in cannabis is also in pine needles. And from pine needles, we know that they have a specific weak kind of aromatherapy effect on health. And the same is true with linalool in lavender. So beta-caryophyllene is in black pepper. So let's take all the data that we've ever collected about these smelly plants and just use it for advertising our cannabis. So if our cannabis has all these terpenes, then it does all these things combined. Because here's your proof. And again, I think this is an example of Wikipedia science. This is advertising. This is too quick, too easy. Just bunch everything up without asking yourself, is this good data? Does it really apply? Because if you take 10 active ingredients and you throw them in a bucket, does it really mean that you have now the combined medicinal effect of all those things at the same time? Or could they compete with each other? Could they cancel each other out? Could they do things that are not so nice to you and you don't expect? So that's the kind of questions I ask myself in my research. Do you know Lego? Like the little toys that you can put things together any way you want. You can take it apart, you can put it back together again. I love that stuff, even since I was young. And I'm mentioning that because terpenes are Lego. And there's only one piece of building block, and that's called isoprene. I've here shown them in two different colors. But if you take two of those building blocks, you can connect them in many, many different ways, like this and like this and like this and like this. And any way you do it, you create a new terpene. So if I connect them in this way, it's called myrcene. If I connect them like this, it's limonene. And if I have some oxidation here, it's called menthol. So this is how you can easily, with one building block, you can make tons of different terpenes, more than 50,000. And of course, with two building blocks, you're kind of limited. But what if I use 3? Or if I use 4, or even 5 or 6? That is all possible in natural chemistry. So here's humulene, one of those terpenes found very commonly in the cannabis plant. And what is this? Well, here's one isoprene unit, here's a second one, and here's a third one. So this is called a sesquiterpene. 3 building units make a sesquiterpene. So this is how they're made. But the big difference in their structure, 2 units or 2 or 3, is their evaporation point. The smaller they are, so the 2 times compared to the 3 times, and then compared to the 4 times, the smaller they are, the more easy they evaporate. So if I smell a cannabis flower, then the ones that evaporate easiest at room temperature are the monoterpenes. But if I dry my cannabis for too long or too warm, the first ones I lose are the monoterpenes. So I am changing my medicine as I go through my process. When I make cannabis oil or I extract something and I have to evaporate the solvent, that is evaporation. I am losing my terpenes. So everything I do with my cannabis, from the moment I harvest and dry it, I'm changing the chemical profile. So it's really important to know when are we taking a sample for a lab, so what's actually present right now when I'm trying to use it as a medicine. Maybe the entire terpene profile from the original plant is not in your oil anymore. So it's just CBD. There's a very boring list of terpenes and their medical effects. Usually they're kind of moderate effects, so it's not very strong. But this is not so interesting. You can look it up in scientific reviews. But what's really important is that terpenes and cannabinoids together, they work better than just in isolation. And that's called synergy or the entourage effect, right? And that means that if terpenes are present, cannabinoids, they bind better or different to receptors, or there's more uptake in the lungs, or the liver is blocked a little bit so that the cannabinoids are not filtered out of your blood system too quick. Or the terpenes help cannabinoids go into your brain, where there's a lot of receptors that you would like to activate. And that's what the entourage system means. 1 and 1 is 3. So each by themselves have a weaker effect than if you combine them. There's a positive additive effect. But the question is that always true? It sounds great, and that's why, modern medicine is not great because there's only one molecule and we have 100, but is that always positive? What if certain diseases only need pure THC or pure CBD or pure humulene? That's also part of the chemical sorting that we're still trying to do. Just have more of interesting molecules doesn't always make it better medicine, and it's certainly not convincing to most medical researchers and physicians. This is a problem. It's difficult, and it makes things strange. So now we're going to apply this information a little bit to something that we all know about, varieties. Right? Cannabis comes in different strains, varieties, genetics, however you want to call it. And I always compare that with dogs, because dogs are all one species. They can all breed with each other. Sometimes you don't want to think about how that would look like, but they can. But there's a lot of different types. And that is done because of human selection. Humans have created all these different things. And the same is true with cannabis. We've picked them from all over the world and we've bred them into different appearances. They look different, but they're all one species. And now I'm a patient and I'm in this wonderful store with lots and lots of information in words, and I'm supposed to pick what works for me. And how am I going to do that? How am I going to take all the information available to me to make a choice right now if I don't want to listen to a guy who is not a medically trained person? He's not a nurse, he's just a bud tender, and he likes to talk about cannabis, but I'm an MS patient. So how do I interact with this choice? And in my own research, I tried to take at least the most easy distinction and study that first, and that was the sativa-indica distinction. We all agree that sativa and indica are real things. They're different, they have different effects, they have different smells, the plants look different, the leaf shape is different, etc. And you can describe in words a lot of the differences, right? And when I started to do my research a few years ago, everybody was convinced that indica is relaxing, makes you calm down, makes you want to sleep, makes you want to chill, which is great if you have ADHD or hyperactivity or you can't sleep. And that's, of course, because of the CBD. Because CBD was new, CBD is relaxing and calming, makes you want to sleep, so it must be the CBD. And then so sativa is something to make you party, makes you want to go out, make you want to do things, and that's because of the THC. And this is what people had decided on all kinds of websites. I asked all kinds of experts, and everybody agreed, yeah, this is what's happening. This must be true. But none of these people had ever done any test to see if it's true. So I took it upon myself to collect samples from all over the Netherlands. There's a coffee shop system, so there's a lot of choices. There's some legal breeders. There's some research facilities that have a lot of different kinds of varieties available. So I think I collected like 460 samples. Some of them are in this graph. And I just simply looked THC content, CBD content, and I found there is no difference. We want to get high, whether it's called indica or sativa, so we have a lot of THC, of course. But the CBD is almost gone, because the plant is putting all its energy in making THC. So it's not caused by CBD content. So what is it? And now we widen our scope in the chemical lab. We can look at all the cannabinoids and all the terpenes that we can possibly measure in the lab, which was about 48 different ones that we knew for sure what was what. And then we find that it's the terpenes. I will not explain in detail this graph because it's a little bit complex, but you can use statistics called multiple component analysis or cluster analysis to look at 48 different things at the same time for 460 samples. And then the computer can tell you that sativa is linked to these compounds and indica is linked to those compounds. So what this means is it's not one or two terpenes that are an indicator of sativa or indica, it's a complex structure of terpenes that are more associated with sativa or more with indica. And that's because molecules in plants are not made individually, they're made in pathways. So if this molecule, just think about the cannabinoids. If CBG is made, it can be turned into THC, and then it can be turned into CBN, and then, so there's a pipeline. And that whole pipeline can be on or off. That's genetics too. So it turns out that the whole discussion about sativa indica is a chemical question that doesn't have a simple answer. There's not one or two molecules that you can say, oh, if it has that, it must be sativa or indica. But now we have a way to talk about it in a more smart way and try to find correlations between sativa and indica and the effects that they seem to have on patient populations. Now we're talking at a level of communication that really makes sense, that brings us forward. And in the Dutch system, we have 6 different cannabis varieties, and you see here 2 examples with exactly the same THC and CBD content. This one came first. It was a sativa type. And then the patient said, well, but we're missing an indica type of effect. So can you breed us a variety that has similar content of cannabinoids but has a more calming effect than this bedrobinol variety? So based on the research, we were able to actually breed and select that product. And when I went to the market, patients said, yeah, thank you, that's what we needed. So patients won and science won. Nobody has to lose. So I would love it if we stop talking about cannabinoids and I mean cannabis varieties in street names and descriptions and smells and what does it look like when I pinch it and when I take the flower apart, but just do the chemical work so that in the future hopefully we can say this cluster we call cluster A, this is good for pain, this is a cluster B, it's good for spasms, and this is cluster C and it makes you sleep. I think it would benefit everyone. And the cannabis culture behind this doesn't have to lose anything. It's just a smarter way of communication. So my conclusions, cannabis comes in many different forms and shapes, and you can have all kinds of feelings about them. This one is expensive, this one is handy, this one is, works very fast, this one is what I use before I go to sleep. But that's not the real discussion, because administration forms for medicines, they have rules. They're supposed to bring the medicines, the chemicals inside, to the right place of your body in the right duration of time. If you take it and in 10 minutes it doesn't work anymore, that's really annoying because I have to pop pills all the time or I have to use my vaporizer all the time. So I would like to have the right duration, not too much and not too little. I would like my cannabinoids and terpenes to be stable for the time that I have it in my house. It has to be practical. Bioavailability is a big discussion with CBD. If you swallow CBD, 95% comes out in the toilet, so that's lost money. So how do we do these things for cannabis? We're still in the middle of sorting it out. So as a result, if you have a discussion in society about is cannabis a medicine, I think both sides have good arguments because yes, of course, we know that it works for many patients. That's why we have meetings like this, because we heard those stories. We know that there are several active ingredients known, but we have THC, we have CBD, so what's the discussion? It was in the pharmacopoeia a long time ago. And we even have some clinical trials that are popping up that are starting to prove that some things indeed seem to work as we expected, but we haven't made a choice about administration forms, dosing, and standardization. So as long as we don't do that and we allow everything to compete with each other, it's really difficult to see clear patterns. So if we talk about acceptance, also in Portugal, we'll see that a lot of the authorities are like, yeah, sure, medical use, right? You're just trying to find an excuse to get high. It's still, even today, this is a very active sentiment. It's a stupid one, but this is behind it, because we're only telling half the story. So cannabis is basically between two worlds. Now we only have modern medicine and alternative medicine, and cannabis is both or neither, because it's too herbal for modern medicine, it's too complex, all these molecules sitting together in a plant like a product, but it's too potent, especially because of THC, to be an alternative medicine. You can't say, oh, just figure it out with your herbal doctor, have fun, because we're talking about narcotics. So there's no regulatory box right now to put cannabis in. And that's why cannabis programs all around the world, they're always different. They're an exception. They're made specifically for cannabis. But there is no other medicine that gets such a treatment. It's completely unique. So if this is what we would like to see in medicine, we can't have that. We don't have the chemical data to know exactly how all these cannabinoids and terpenes work, and we also don't have the clinical trials. It takes time. We're working on it. So what we have to do then, if the chemistry is still underway and the statistics mostly comes from patients that are collecting data and are discussing it in public, then we have to be really strict on quality because there's still a bunch of things we don't know. So let's be extra careful. And what does quality mean? To me, as a chemist, it means that we know exactly what happens to these molecules from beginning all the way to end. We have to know them and trace them and follow them so we can collect the real information needed to find a proof. And you can already start seeing this coming in certain places, smarter labels, not just THC and CBD content, but kind of a overview of the most important compounds that are present. But the thing is that this information comes from labs. And the other problem in this discussion is that labs don't agree yet. They have different methods. There's labs that actually they commit fraud because it's a big market and they want to present their customers with high numbers because high THC, high CBD is good. So we don't even know if we can trust the labs yet. So I think we have to start with labs to make sure that the labels are always correct. Because as a consumer, you have the right to know what you pay money for. Even if you don't care about safety, you're spending money on a product that maybe has no CBD. That should make you a little bit upset. So the challenge right now is how do we bring together the needs of patients with the rules of modern medicine, with safety, science, cost, etc. If you do everything the pharma way, great, you solve a lot of issues, but what about the cost? What about access? If I have to discuss with my doctor, can I please have this medicine? That's not necessarily a better world, right? So we have to keep learning. That's why we're here today. And thank you for inviting me to share this story. And if next time you look at a cannabis grower like this and you think about chemistry, then I think I've succeeded today. So thank you very much.
Yeah. Oh. Can we have a seat?
Yeah, oh yeah.
Please.
How can you patent something that is so complex?
Microphone, please.
I don't think you can patent it necessarily, because I didn't talk about patents. I talked about understanding the complexity and how things interact with each other. Oh no, I'll stand, that's fine. Oh yes, right. That is a good reason. It's a very comfy chair. I think you cannot patent the cannabinoids per se. You can patent an administration form and an application, right? Epidiolex, CBD for childhood epilepsy, you can patent that and then you have a protection. But I believe that's not the way to go, because the idea of CBD working on epilepsy was not from GW Pharmaceuticals. They took something that was there. They said, okay, let's follow the rules the way modern medicine is done. And now we're patented, so everybody here stop doing what you do. It's my CBD now. And I think that has no chance in hell whatsoever. Because if 100,000 people, 1 million people are already doing it, they're making extracts, they're selling it, they're producing it, I don't think you can protect a patent like that. So I think that there's no way they can win that game, except when producers of CBD make such a messy product, with solvents and with pesticides and with CBD that's not actually there, then they blow their chance, because then the general public says, well, you had your chance, but you give me crap. So maybe I'll start thinking about Epidiolex anyway, because it's more expensive, but what if it becomes reimbursed by health insurance? And that's not a problem anymore. So I think that the whole discussion about free CBD versus pharmaceutical and patented CBD or other cannabinoids is not over yet. And I would love to be part of the discussion of the small producers. I don't want CBD to, or the cannabinoids to become only a pharma product, but it means that the industry has to clean up their act. Otherwise, they may lose this battle.
Thank you.
Great point. Any other questions?
There's one over there.
Great.
I like your presentation. Thank you. You mentioned that it is important to have quality, to know what we have. What do you think about the synthetic origin of the terpenes and the cannabinoids?
Well, but the way I always say it is a molecule doesn't remember where it comes from. So if it's 100% pure, it makes no difference if it's synthetic or it's from a plant. But the thing is that the plant is not 100% pure. It has all these different molecules. But theoretically, if you take the molecules you would need, even if it's 10 or more, and you mix them in the right proportion, then synthetic and plant-like is exactly the same. And usually those decisions only are determined by cost. Is it cheaper to get it from the plant, or is it cheaper to get it from synthetic? And of course the purity. If the purity needs to be 99.9%, then maybe synthetic is going to be the future. And already there are scientists that are trying to make Thc and Cbd, for example, in yeast cells or in bacteria, and that becomes possible now. So that's just science doing what they do without thinking about the social consequences, and then it becomes a competition on cost, quality, what do patients want. And that's why my discussion was, do we always need an entourage system? Because if there are certain diseases that only need 100% pure CBG, for example, then why would we want to take it out of the plant when it's 10 times cheaper to synthesize it? Because then it becomes a moralistic discussion, like, should we do that? But it's not based on economics or on quality. So of course with cannabis, all these things, they play a role at the same time, and that's what makes cannabis so complex. Because with normal medicines, you don't have an opinion where it comes from and how it's made. You just use it when the doctor prescribes it. But with cannabis, we all have an opinion, and that makes it so interesting, but also very complex, I think.
Sure. I have a question. Doctor, you mentioned before that you're uncomfortable with a large pharma company controlling the molecule of the plant. On the other hand, we all buy medicine from large pharmaceutical companies, and if we want aspirin, you or I are not taking willow bark in our bathtub to create salicylic acid.
Yep.
How do you create a standard where all of us can feel safe with a small business owner with CBD? Isn't that an unrealistic and very expensive proposition?
I don't think so, because if you do everything the pharma way, it's going to be very expensive. But I wonder if cannabis products should be all the way at the level of pharma products. And when I say it's not, I don't want cannabinoids and cannabis to end up in the hands of pharmacies, because they never did anything to earn it, right? It was a social movement of people who were fed up with modern pharmaceuticals, not just the way they worked, but also the way that physicians interacted with them. They felt not helped by the medical system, and then cannabis became kind of a symbol of how you can do things different. And I'm a little bit worried that because of the pull of the pharmaceutical industry, but also messing up of the cannabis industry, that we're losing that way. So what you need to have is industry standards. So yes, it's good to have a business that's small, that's not pharma level, but then you have to agree. If there's 10 companies and they all have their own lab doing things in their own way, that's not going to help. So you need standards for testing. You need inspections. That's one thing I really miss in the cannabis industry, is things like inspections and audits, because everybody says, no, you can't see anything, you can't ask anything because it's secret. But trust me, it's perfect.
Sure.
And that doesn't work in the food industry, that doesn't work in pharma, it doesn't even work in the car industry. You need government inspectors to come in and see if you do what you say you're doing. And then the third thing is you need consequences. If you mess up, you have to leave and you get closed. And we all know that inspectors and regulators from the government are not really putting that much effort in enforcing the law on CBD, because sometimes it's not even clear what the law is.
Sure.
So we're also in that sorting process.
Great, thank you very much.
Thank you. Well, I guess we have time for one more question, if there is one. Yes, there's another one right over there. Just a second, you're going to get your microphone? Yes, thank you.
So where do you see, I mean, you spoke a little bit about the chemistry proving effects, and you know, the current traditional proving effects is through RCTs, randomized clinical trials, which are expensive, can be afforded by big pharma, big investors. That's what regulators look at when they prove safety and efficacy. How do we do that when we have a multitude of compounds to prove effects of the currently used compound? Should we do observational trials? What do you see is a prospect for that in the future?
Well, what's the alternative to expensive clinical trials? I think the answer is very easy. It's called patient-inspired research. So what you do is there's thousands, millions of people using cannabis around the world. So what if we asked all these people, and I know this is theoretical, but what if it's possible to ask all these people, what is cannabis or CBD doing to you? Mm-hmm. So you do a survey, and at the end of the survey you said, and now I would like to have a sample of your product. So don't tell me it's CBD oil, so I think that CBD oil is causing all this, because I know that all the CBD oils are different. So I want to link your oil or your flower to your outcome. And if you do that, and you look at the statistic, you'll see that some compounds, like I did with the sativa indica comparison, are linked to specific medical effects. And that's when you have, so initially you have 100 varieties and 100 diseases. And if I'm a clinical researcher, how do I know which combination I should research? That's impossible. But if I go through this survey process and I test actual products, then I have narrowed down the thousands of possibilities to just a few. Like, hey, every time people talk about CBD, and I analyze their oil and I see that there's CBD in there, they say that their child has less epilepsy. That's interesting. Now I turn it around. Now I can do a clinical trial, but I already know what I'm going to research. So I've filtered out all the noise, and I'm focusing on what already works in the real world. And I think if you can do that, then you can really speed up things. So there's medical programs all around the world. In Holland, we've done that, for example, in a pharmacy that makes their own CBD oil, so they know what's in the oil, because they make it with bedrocan flowers, and that's standardized. They know their patients, because they're a pharmacy and they're their patients, and they know what their medical condition is, because they know the physician. Mm-hmm. So if you bring that all into one database, they could clearly see that certain patients, they were really responding very positively to CBD on spasms. So you're one step away from an actual clinical trial, but you spend almost no money. You're just looking in your pharmacy database. So instead of it costing 40 million, it costs 40 euros or something like that. So if you do that more often, I think you can really learn a lot.
Yeah. Thank you. Thank you, Doctor. Michael, anything else?
No, I think we're all appreciative of your efforts and your wisdom. Thank you so much for sharing it with us today.
I think I'm going to sit here the whole day.
I don't know if you can get up.
Yeah, we need to give the place. Thank you.